Sleep apnea, it's not an infection. You did not just get it yesterday. This is something that has been, it's a developmental issue. It's been happening on the continuum.
At the forefront of sleep medicine, Dr. Stanley Liu, a world-renowned sleep surgery innovator, Master of Medicine, Dentistry, and Surgery, former Stanford Fellowship Director, with over 120 published works of medical studies and pioneering groundbreaking techniques in treating sleep apnea, Dr. Stanley is redefining how we breathe, sleep, and live.
All along the way, you want to optimize your ability to breathe and sleep well. A great night's sleep really sets people up for a great day the next day. I have the ability to help people breathe better, particularly during sleep, where we have the most mystery and unknowns and most potential.
What is the biggest misconception of this field by dentists or by patients worldwide? A very good morning, everyone. Welcome to Malaysia. And we have a very special guest today, all the way from Florida, USA. Welcome to Malaysia, Dr. Stanley Liu. For those who do not know Dr. Stanley Liu, maybe you would like to talk about yourself and introduce yourself in about 2 minutes. Yeah, what do you do?
Thank you, Dr. Chua, and thank you for your hospitality. And it's been a real pleasure and inspiration to see what you all do here. I'm Stanley Liu. I am trained as both a dentist and physician, both as an oral maxillofacial surgeon and a ear, nose, throat surgeon specializing in sleep apnea surgery. I've always been the beneficiary of working at the intersection of fields where we really need that collaborative care. I have been both an associate professor at the medical school at Stanford, and then currently I chair the oral maxillofacial surgery department and run a sleep and wellness center in South Florida.
Amazing. I mean, your journey of how you got your qualifications and what you're doing now has been so inspiring. And when I first got onto your website, which is drstanleyliu.com, your motto on your website says that restoring sleep breathing health as a gateway to wellness. And that hit me really hard. And I've been wanting to meet you, and it's such an honor to have you here. But what does it mean and what do you actually do? Because you are a medical doctor and you're a dentist at the same time, you're oral maxillofacial surgeon and an ENT. What do you do?
Yeah, that's a great question. But I will say that phrase is more of an evolution, in fact, of reflecting my work. In early stages of my work, of course, is our surgical training, etc. But it's my contrarian truth. It's one important truth that I really believe in that makes my worldview and clinical view different. And that is that I have the ability to help people, or I like to try to help people breathe better, particularly during sleep, where we have the most mystery and unknowns and most potential. And that great night's sleep really sets people up for a great day the next day. And I think that's why, folks really want to have that good quality sleep. And where I can contribute the most is the breathing aspect of it.
Okay. I think in layman terms, it's a lot of what is going on out in social media now is about sleep apnea. And we have so many social media products as well as advice that are being given to the public. And I think not just the public, even to dentists, we don't know how to treat sleep apnea. We do not know what roles we play as dentists as well. How would you advise a dentist, or what best advice would you give that if a patient complains about sleep apnea, I don't sleep well, I don't do well, what should they do?
Yeah, I think so. Sleep apnea is the more common term that we mention, but it lives on the spectrum of what we call sleep disordered breathing. So abnormal breathing patterns during sleep, which includes snoring, a subphenotype called upper airway resistance syndrome. There's sleep apnea, which in itself has several different subcategories. So there's a lot there. Okay, so I think if we generally think about it as how can we help our patients, breathe in a more healthy pattern during sleep? That's sort of our common collective goal, and that's where we make the most impact.
I see.
Diagnosis is key,
Yes.
and as you mentioned, really the first thing that brings to our attention is the patient complaint. Now, we may have a lot of patients who say, I have sleep apnea, I need treatment. But a lot of times it's about the symptoms that are caused or highly associated with sleep apnea that they mention. And those are the clues that, dentists and healthcare providers want to be able to pick up. And from there, do the proper workup.
Well, I think a lot of us are trained in such a way that we are not supposed to deal with this part of medicine. And often dentists will say, okay, please go see an ENT. Then nowadays in the social media, it's like, go see a dentist and get an occlusal sleep apnea appliance or something of that sort. And everyone is trying to put something out there and tell them that it works. How do you know whether it works or it does not work, or does it get better or does it not get better?
Yeah, that's truly the whole challenge of it, because the good news is there are a lot of people and a lot of different solutions.
Yeah.
The tough thing is who benefits the most, from what treatment. So because of that, you have all of this fragmentation. And so depending on your feeds, in your social media, you may be directed more to one specialist than another.
Okay.
But ultimately, it really does require a methodical, systematic workup that hopefully leads you to, the right and the best person that you have in your community. So I think the good news is the awareness has been brought about by so many different channels. And the tough thing and the challenge remains that how we organize it and guide our patients.
I think one of the hardest thing is to find somebody like you who is doubly trained on both ends and still be able to perform the treatment and the therapy yourself. So how do patients get to you in the States? Like, how do they find you? How do they even know something is wrong? And do they get referred, or do they come straight to you?
I think in the earlier days, there's a lot of referred patients, and in the sleep disorder breathing field, they would come from your sleep medicine doctors, your maybe your fellow surgeons, other dentists especially. You have myofunctional therapists who may all be part of that referral circle, but increasingly, of course, patients are self-referred, or they may have seen some specialists. Patients do their own homework, and then they somehow find their ways to us. The joke, of course, is for surgical treatment of sleep disorder breathing, especially sleep apnea. I used to joke how patients accidentally take the wrong turn in the hallway and find out that there is a surgical solution. Because in the old days, really, or in the earlier days, I should say, the drive and the majority of the interventions remain to be a more conservative medical management.
Does it mean that the conservative management doesn't work, or is it because of wrong diagnosis? Because I want to get back to the spectrum that you were talking about. And I think that's very interesting because to us, sleep apnea is just one diagnosis. And you've just mentioned that there's a whole spectrum. So how do we know which spectrum patients are at, and how do we get to a place where they can help us do the diagnosis? Because when you see an ENT, the ENT will say, it's the upper airway, or take out your adenoids and all the suggestions that they come up with. So how do patients know which is good, which is bad? And
so I think perhaps the most important that I've found, and we'll talk about all the other diagnostics that we can do, but the patient story. And then if you're an adult patient, let's say the bed partner confirmation of the stories, or if you're a parent, you seeing your kids sleep. The story actually is really very, very critical, because that drives us to the clues, to the things that you want to be looking out for. Amongst that, what we call patient-reported outcome measures. So these validated questionnaires that we can use for all the different doctors to communicate with each other, that's really important too. If the patient says they don't breathe well, they don't breathe well. They told you that. And that should be the focus of our attention. After that, a solid, well done polysomnography, ideally in lab, but the reality is a lot of times it is also done out of center, unattended. And that would be the very bare basic that you would start to then go on to the next steps. But I think that attention to the patient's story, including how they were sleeping and how, let's say, bad sleep affected their day-to-day performance from childhood, absolutely matters. Their childhood allergy history, their dental orthodontic treatment history, they give you clues, right? If someone had to go through 5, 6, 7 years of orthodontic treatment, something is very challenging there, right? If someone who's had to deal with bad, nasal allergies for a long, long time, it's telling you something. If a child, at age 7 or 8 is still having bedwetting issues, or teachers notice some, kind of cognitive or behavioral concerns, that all tells you something, right? And that part of the story is critical.
Oh, that's amazing, because we all, as dentists, we just look at patients and think that it's at that cross-sectional point of time and we're trying to do a diagnosis, but it's actually the history. And it's so important that you've just mentioned about kids, which means, is it possible to even start treatment when they were young and prevent all these possibilities of surgeries and heavy treatment that needs to be done? So I think that's what you are advocating now. Can you tell us a little bit more about that?
Yeah. So I always say, I oftentimes remind even colleagues and patients too that sleep apnea, it's not an infection. Right? You did not just get it yesterday. This is something that has been, it's a developmental issue. It's been happening on the continuum. So you really have to look at it longitudinally. You did not get sleep apnea just on the night that you got diagnosed with a sleep study. Okay, so early recognition is almost, it's critical. And perhaps a more better known analogy I can use is perhaps, let's say, diabetes. By the time you get diabetes, it's really, really late. But prior to that, some people might have, let's say, elevated, fasting, blood sugars, or, there are clues. There's pre-diabetes and even just the general public, kind of getting an awareness of it's important, if we can, to not have our blood sugars kind of spike, for example. So it's very much the same thing all along the way, right? From day one to whenever. You want to just optimize your ability to breathe and sleep well. Breathing is just the first step, of course, but we're still just scratching the surface of that.
No, I think what you say about breathing is so important, because we don't realize how much we have to breathe and what this whole region affects us. And I love that part about diabetes. It's just like periodontitis. As a periodontist, we have so much issue trying to explain to patients why it's not a sudden disease, but it's a continuum, like what you've mentioned. And early diagnosis, I think that's the key to what we have to do.
And I think, you're right. The periodontitis is another great example, right? They didn't start to become, teeth didn't start to become wiggly yesterday. This has been, sure, there are different underlying, let's say, propensity for periodontitis, but ideally you do preventative care, all this stuff that we do to prevent patients from having to deal with very bad periodontitis, right? So
you sit in the intersection of medicine and dentistry, so as well as wellness in actual fact, because you talk about breathing. So what is the biggest misconception of this view by dentists or by patients worldwide?
I think and it may or may not be a misconception. It might just be a way to look at it. And I'm not a fan of the just the disease model of looking at it. As we said, by the time someone has bad obstructive sleep apnea, it's not even just that concern. Bad sleep apnea, will make everything else worse. You're, dealing with mental health issues, other systemic health issues, or just your day-to-day productivity. It's not going to make it better. So, so not so much of waiting until it's a real condition to treat, but our active everyday care, right? To remind patients of sleep hygiene, sleep airway health as we see them. It really can be integrated to our day-to-day care as part, right, of our comprehensive care. So I think that is an important one to recognize. We don't want to see this as just a disease. And I always say, even people who sleep and breathe really well want to sleep and breathe better. And that's the part of the wellness aspect, right? There's the thing about optimization of the hours that we spend snoozing. So
no, I think that's brilliant, because nobody has ever talked about wellness and prevention for sleep. And a lot of us, parents will bring kids for dental care at a very young age, as we know now. And nobody talks about sleep, but everybody talks about, maintenance, check. Get a check, get a clean every 6 months, but we don't talk about sleep. Like, why do we need to care about sleep? And I think that's the bit that you're doing. Hopefully we are able to do that for you as well on this podcast. Now, coming back to a little bit of technology. Technology has changed this field, I assume, so much with wearable rings, apps, Apple Watch, sleep monitoring. It has brought this back to home and pushing it back to patients to monitor themselves and diagnose themselves and start getting treatment themselves. So are there any red flags to those wearable equipments, or what do you call them? There's so many types.
Yeah. And it's overall it's a good trend. And it also, again, goes to show, because it's so hard to know what our brain is doing, what our body is doing when we're sleeping, that this wearable technology is great. Now on the commercial level, again, it's fun, right? And you can track, and I think it does give good data. And remember, that data is not information. And depending on how that information is used, it may not be the whole truth, right? But it's key. It's very important to remember that we still need a formal diagnosis. In terms of sleep, a good sleep study, including an entire night's reading of the EEG, so we know your sleep staging. We know how even minor reduction of airflow can affect or can create microarousals, and that may be contributing to the patient's symptoms. And so all of that, right, that is the diagnosis, and that does have to be established. Now, understand, we can't do that level of testing every night, and that would not be practical. So the continuous monitoring is great. But there is a key difference between a diagnosis or what we can use these other things as, maybe screening type devices.
Okay. I love that word, screening type devices, but not a real diagnosis, because a lot of people are probably using that. And that's what's causing the spectrum of over treatment to non-diagnosis and under treatment. I think that's where it's so hard, and it is so hard to advise the public and for you to even know where to go. So there is this thing now on social media, and there are two things that are extremely popular: mouth taping as well as nostril expanders. I would just like to touch on that. I know it sounds different, but what are your comments?
Yeah, I mean, these are, again, people like non-invasive and quick ways where we can test something out. For example, I always think let's, when we talk about, breathing during sleep, for folks with high nasal airway resistance, they may revert to mouth breathing, right, or other anatomic concerns. So sometimes it may be a cool little screening thing as well, right? If someone just cannot tolerate mouth taping, it may just mean that they really can't breathe nasally during sleep. And so they're going to rip that thing off and they're going to mouth breathe perhaps. Okay. And so I think, again, it's one of those things that brings about awareness. The nasal dilators are the same. They're all these non-invasive things. You can get over the counter and you can try it. And I really think it's those are great things to try and have the users kind of recognize that, maybe when I use a nasal dilator to sleep, I feel better the next day. So there's some truth to it. I may not want to wear a nasal dilator forever. It's a good clue that you could share with your dentists or surgeons and say, hey, is there something that you can do so that I don't have to wear a dilator every night, right?
That's so kind of you. I mean, in periodontitis, it's very different because we have patients coming in telling us that you can just use oil and everything else to treat. And unfortunately, it's delaying the diagnosis and causing more harm. Yeah. Will that happen in sleep and breathing?
There's a lot of that, right? There's a lot of, let's say, enthusiasm and the hope that this one thing will be just enough, will be adequate. And gosh, I mean, I always describe, to breathe properly during sleep, the entire system has to work properly. And by that, I mean, we like nasal breathing because nasal breathing helps the upper airway dilators muscles dilate. Those muscles are supported by the jawbone, right? So that entire system has to work properly to have proper sleep breathing, proper breathing during sleep. So, it would be rare for one thing, to solve it all. But I think everything contributes to it.
Thank you. I think that's the message that we need to tell, that not one item or one product or one way can solve the issue, and it's a whole system that comes with it.
We have it on the surgical side. We have, for example, we have our hypoglossal nerve stimulators. There's 1, there's 2, then there's 3. How many different types of maxillary expanders are there?
Yes.
How many different ways do people do soft tissue surgery, the uvulopalatal-pharyngoplasty? How many different claims there are to skeletal surgery, such as the MMA? And therefore, yes, there's a lot of
yes. It's actually confusing for us. And I think what's more is, as dentists, we graduate with very little information on sleep or obstructive sleep apnea or whatever that you're diagnosing. Now, how do you think for the younger ones that are coming up now, how do you think they should get the knowledge or get the training to be able to help in this entire ecosystem that we're talking about?
Yeah, I think there is a pressing need. Unfortunately, there is, as you know, both medical and dental curriculum, there's already so much and so much for our students to learn during a very limited time. It is hard to tackle all topics, but this is an important one. And this has to make its way to the curriculum, even as a good, solid introduction as early as possible. The division of these disciplines is a funny thing. It's almost like oftentimes we see the dental focus being, let's say, below the nasal floor.
Yes.
And let's say other things, above the nasal floor. Yes. But it is one nasal floor, and they are connected, right? And so I think incorporating that into the curriculum, it's timely. It's got a pressing need. Yeah.
I'm so glad you say that. Hopefully somebody will hear this, and you are already advocating that in your university.
We try. Luckily dentists have always been very keen on continuing education. And so they're really good at picking out courses to do. But, inevitably courses can be costly, and also if you never had a foundational knowledge, it might be hard for you to discern, right? The quality of the courses and what to take is always very confusing. So that foundational knowledge, will be key. And luckily in the end, it's really not that complicated. I try to mention it in some of my lectures to students that if we want to boil it down to a very bare minimum, it's a 2x2 table. It's nasal breathing, mouth breathing during the day in wakefulness, and breathing during sleep. And this is the interaction that we're focused on. And so I mean they responded well to something like, oh, okay, that's what we're doing.
Yeah, I've attended your lecture, and I love it that you've brought it down to the 2x2. And I think we need to share this on this talk, and we'll probably show your slide as well. So that really keeps it simple and makes it easy for dentists to realize, is it nasal breathing, is it mouth breathing, what's going to happen, and how do we send to the right people to treat as well. So coming to that, there was one thing that I picked up during your lecture that was extremely interesting, which is sleep has an effect on mental health. And you have gone on to look beyond what is treatment, but what you can do to improve quality of life for people. What are the real effects and what do you see?
Yeah. So
in your patients, especially.
Yeah. So I feel like our first step, right, is to allow people to breathe comfortably during sleep, to start to enjoy the positive effects and sort of where we can make impact. One such area, as an example, and this is very, very contemporary effort, let's say in the U.S., but I know colleagues in the field. I'm pushing in this area, and I think it's very meaningful. And that is that, for example, if we are able to, get patients into REM sleep, and that during REM sleep we can actually deliver, treatment, particularly in the realm of mental health, in things that, just like, in things that we can't treat during wakefulness.
Yes.
Turns out that there are ways that we can treat during sleep, particular stages of sleep, but we have to get there. And so I think mental health being such a pervasive, issue. I'm not saying, bad sleep and sleep apnea is the only cause of depression and anxiety, let's say, as an example. But certainly having sleep apnea is not going to help anyone's management of anxiety and depression. So I think that one, once we can get folks generally to breathe well, that absolutely is the next thing to tackle.
No, getting a good night's sleep is so important in terms of performance during the day as well, and the mood of how you feel, what you do. I think a lot of people don't think too much, and especially with men, but women, we tend to think a lot, and we tend to use our feelings a lot. And when we don't get a good night's sleep, I'm quite sure we are all grumpy. That's right. Okay, we owe a lot to our mentors, and you've had an impressive journey in dentistry as well as in medicine. What was the most defining moment in your career journey? Coming back to you now.
There's been so much, but let's say at least by way of sleep disorder breathing, and I do owe much to the two mentors who are technically the pioneering surgeons in the field, and Dr. Nelson Powell and Dr. Bob Riley. But their journeys are very interesting too, because they actually were dentists to start. They finished dental school, gone on to medical school, and they met as ENT residents at Stanford. And then it had to be that they were in the same building with Christian Guilleminault, who had, of course, defined the clinical condition of sleep apnea, amongst many, many other things. And that synergy between Christian Guilleminault, understanding the importance of breathing during sleep, and then between the two mentors who had that dual training. And when I first met Nelson Powell, and then again, Nelson is really sort of the career mentor, just seeing his approach and then seeing how this collective expertise, let's say, of combining things at the interface. He actually used to call this interface surgery. A lot of the nasal surgery he did, and because it was between skeletal tissue and soft tissue, really merging. So really inspired just by his general approach to patient care. But I think that it made me more convinced that the path that I was on is a way to get into their mind and get into their mindset and learn off 30 years of their collective experience. So I probably can't, there are many great fun moments, but I think it's that general almost, following your mentor, following their tracks, and then standing on the shoulders of the giants. I feel like a lot of the work that I've done really is just to translate what they have seen to the world, so the
You're
world
way
can
too
see.
humble.
No.
You're way too humble. I think what you've done and where you've been, it's extremely inspiring, and that's why I wanted you to share this story, because you really rode on the shoulders of giants, and on top of that, you were able to distill what the other 30 years of work was and put it together in simple layman terms of how we should actually diagnose and how we should actually treat now. And I think that is extremely rare.
I'll share a fun story for the dental audience, which is remarkable. When Christian Guilleminault had a big red binder in his office, and he had all these dental papers and correspondences with dentists who actually were noting these issues from the 1980s.
Wow.
And so now it took there is a whole bunch in there on maxillary expansion.
Yes.
And it took another 4 years
Yeah.
before I remember when he really pushed myself and colleagues to do adult maxillary expansion to really address things in the transverse dimension.
Yes.
But what's so interesting is he was absolutely already thinking about it way in the beginning in the 1980s. So again, for the dental audience or for some who are concerned, should we be in this or not? Are we relevant? You are tremendously relevant. There are things that the dental professional can contribute to this field that is unique and impactful.
Yes.
So it needs to continue.
Thank you.
Yeah, it needs to continue.
that's inspiring,
Yeah.
and that's going to put us forward and hopefully in our field to really pay attention to sleep and breathing. Yeah. All right. What's the one thing you hope for every patient or teacher or young dentist to listen to or take away from you? Yeah, from this conversation.
Yeah. I think we're standing at a point where this is sort of the next big, whether you want to call it evolution or revolution, maybe more so evolution, but sleep disorder breathing, right? The ability to impact an entire society on the ability to breathe comfortably during sleep, hopefully leading to improvements in mental health, systemic health, and all of that. We have great evidence that it can do that. This is a pivotal moment. If you are talking about oral health and how that impacts systemic health, this is it, right? This is the next big one, okay?
Yes.
We've done a great job keeping teeth alive,
And
keeping some kind of
periodontitis.
teeth. We've done a great job with so many things.
Things.
This really is the next one. Oftentimes when you look at, for example, care in children,
Yes.
and a lot of times, for example, one of the most significant ways that you can actually change and affect nasal anatomy for better function, coming by way of, say, maxillary expansion,
Yes.
all that is
Yes.
very unique for the dental profession,
Okay.
right, to
Correct.
contribute.
Yeah.
In the U.S., for example, the stats usually say that patients see their dentist or their hygienist more than they see their medical doctor.
It's true.
They open the mouth, you have a lot of signs on whether your patient's actually breathing well or
That's
not. So we are right there, and there's so much positive impact that we can do. And this also then brings dentists into the mix of all the other healthcare professionals. We get to work as a team. Other things we do in dentistry, we may work with other dental specialists.
Yeah, but we don't.
But we are all, we can't be siloed there, and this one allows us to connect. So it's a great moment for the field.
No, it's exciting actually. It's exciting.
Yeah.
Can you just one last question? Is there a life-changing story from your patients? I should have asked that earlier, but is there a life-changing story that you can share on one of your patients after getting treatment?
Yeah, there are many. I'll just I'll mention a whole bunch. Okay,
Not a problem.
or maybe because and sometimes two of the patients are actually even before I had the chance to really quote unquote take care of them. And what I mean is, I still recall during my pediatrics rotations, I was in medical school. I was on a pediatrics rotation. And there was always this child with Down syndrome that would kind of stay in the hospital extra few days after, let's say, they had an upper respiratory infection or a pneumonia, let's say. But I felt like, no, but, and one of the reasons why we don't discharge the patient is because they, like at random moments, you would do like an oxygen saturation, right, measurement, and it would be low. So they think the pneumonia hasn't cleared, and they're going to keep the patient a few days overnight. But I swear that kid had had sleep apnea. And I
Snoring.
couldn't, and this was in a public, trauma hospital, and we
Yes.
can't really
Too
do anything.
much.
So I went to work with a respiratory therapist, and we rigged a made up sleep studies where
Yes.
we gave him a continuous night of monitoring and whatever other monitors we could put together
Yeah.
in the hospital. And then, so I was able to suggest to the care team that, one of the things you have to note is that he doesn't just desaturate when he comes into the hospital with pneumonia. He desaturates every
All the
day.
time.
So we need to treat that. Okay. And so, because by then I had already fallen so much in love with sleep and sleep
Yeah.
disordered breathing that, I was already picking that up.
Yeah.
I also remember one of a big guy that got shot, and with a resident myself, we actually did a chest tube for this patient, and he was recovering and all.
Yeah.
And one night I was rounding on him at 2 a.m. I could hear him snoring from the end of the hallway. So I got him a CPAP. And then he loved it so much. He went home with one. And so I think even before I was able to take care of patients, I was trying to find ways to take care of them. And now that I have more tools,
Yes.
I've taken care of the 65-year-old with the AHI of 145 with MMA surgery and upper airway stimulation, hypoglossal nerve stimulation. I've also done care for families where you first expand the child, and then the dad and the mom and everybody.
The whole family.
The dad and the son were expanding the expander at the same time. The kid, of course, was beating the dad, so much faster in that process.
Obviously.
But every patient story is life changing. In the failures, in the successes, in a lot of failures is also very heartbreaking because they put so much hope that you can help, and you try really hard, and it doesn't always work. But just like I think about it when even I was just a medical student or a surgery resident, our willingness and our desire to help, it only adds onto it.
Yes.
And now if we get more collaboration,
Yes.
I think again this is a pivotal moment.
It is. Right, helping and changing people's life, because sleep is so important. It's even more important than teeth.
Well, it's
we breathe to stay alive.
it's all important, right? Bite, breathing, and beauty, all of it. Yeah.
That's true. Well, we're coming to the end, and I would like to thank you for coming on for this podcast, and we definitely would love to invite you back, and we're going to go into more details as well. Part of the reason why we started this was to bring joy into people's life, and I think one of the designer that inspired me to do this is Optimist, and he was Gustav Ehrenberg. He designed this Optimist toy, or it's not a toy, in 1968. And to remind us that every day we need to keep a bit of joy and put a bit of joy out there, and the embodiment of smile, optimism, and good mood. And this is for you.
Oh, thank you.
And your daughter.
Thank you.
You're welcome.
Yeah. Does this thing bounce or how
It balances.
It balances.
You should just try it. See it. Did we get everything? You should pull it out. It's so cool.
Oh, the whole thing comes out.
Yeah, the whole thing comes out.
This is fun. This is funny.
Yeah,
It stays on the table.
No,
I mean,
no.
it
It stays on the
you
table.
stick on the.
I'm just going to show you how it works. Sorry. How do you slide this out? Can I destroy this? Okay. You know what it does?
It just bounces, right?
It just bounces and just keeps you happy. And if you look at it from far, I've looked at it for one whole day. And you know what my son did? Mommy, wow.
Yeah. Oh, that's
Started singing a
awesome.
song. No, but it reminds us to stay happy. Yeah, it reminds us to stay happy.
Keep the bounce in the steps.
Yep, keep the bounce in the step.
And don't overexpand your mindset.
Don't overexpand. That's true. That's true. Overexpansion. Yeah.
Thank you.
Thank you so much, Dr. Stanley. And,
Thank you.
And thank you for doing this for us, because this is what we do for patients. And hopefully from here, we're going to bring lots of joy and lots of people sleeping better, breathing better, and also inspire a lot more dentists to look into this field. And
You had no puns intended, right? About breathing and inspiring other dentists. No, but thank you. Though this is being able to get the word out, through the right channels. Hopefully, give as much solid, tempered information as possible.
That's right.
I think that's also very critical. Step.
Yeah.
Thank you.
Thank you.
Thank you.
Thank you so much.